Hi, everyone, and good morning. Thank you so much for being with us for House Calls, Real Docs, Real Talk. I'm Carrie Pena. This is episode 3, and we are so excited to have so many of you checking in with us each week. And we're going to be taking your questions again today, straight to the expert. I've got my iPad here. I've got my phone. We've got our computers hooked up so we can monitor all of your questions as they come into us live time. This weekly show provides an opportunity for us all to come together and ask questions of the experts and hopefully walk away with your answers, giving you answers to your most pressing questions. If you have a question you'd like us to address, you can visit us at heart.org/housecalls, and you can go ahead and submit your question or drop it in the comments at any time. We are monitoring. We have a great team in sub-control. Our production team from the American Heart Association is standing by to help us with the show, and we work really hard to answer as many questions as we can throughout the program. As a result of how many questions we've been receiving, we have decided to launch a House Call post show in the coming weeks where we'll be able to follow up with our experts on any questions that we run out of time for during the broadcast. So stay tuned for more information on that coming up soon. Last week, I want to tell you that we had people from all over the world joining us. We had folks from Saudi Arabia, Mexico, Brazil, Berlin, Puerto Rico, and so many more. We love to hear from all of you, and thank you again for interacting with us and asking your questions of the experts. So go ahead right now. Please share this stream with your friends, with your family, anyone who you think would benefit from the information that we are bringing you live today. And of course, we also want to hear from you live during our show. And throughout the show, I will ask some poll questions. And we're going to go ahead and ask you one right now. You can text your answer to AHA Live to 22333, AHA Live to 22333. And while you're getting started, let's go ahead and bring in our expert. I'll introduce him, and then we'll put that poll question up for you. Dr. Keith Churchwell is the Executive Vice President and Chief Operating Officer, Yale New Haven Hospital. He is the Associate Clinical Professor of Cardiovascular Medicine at Yale School of Medicine. Doctor, thank you so much for being with us this morning.
Well, good morning. Glad to be here.
We have a lot to get to today. We'll go ahead and put that poll question up as we get people to begin interacting with us, interfacing with us, which is what this show is all about. So we wanted to ask first up to our audience, are you more productive when you're working from home? How have things been going for you? Some people, it's worked really well for them. For others, it's been a little bit of a struggle. Dr. Churchwell, I'd be curious to know, how have things been going for you? I know you're very busy. Have you been working from home, and how has that gone?
Actually, I've worked from home very little. I've actually been in the office, but in that it's mostly been Zoom calls. Not a lot of personal interaction. We've, you evolve and you get used to the fact that you're interacting with people across bandwidth as opposed to actually across your desk. So that's been a lot of the last 100 to 120 days.
It's been interesting seeing everyone, hasn't it, Doctor? Kind of getting used to the new normal.
Yes, I'm glad we haven't seen anybody in pajamas yet, and that actually has been a plus.
We have seen some interesting Zoom calls, though.
Yes, I mean, we've been doing meetings not only locally, but really across the country with and some international. And so that's been unique. It's been a bit innovative. And I think part of this, we want to retire after we're back with the vaccine.
Absolutely. And Doctor, we're so glad to have you with us today. And we have lots of questions we're going to get to on this show. And once again, we'll be asking these poll questions throughout. Just a reminder to the audience, you can text your responses to 22333. Or if you're just joining us and you haven't registered yet, you can text AHA Live to 22333 to join in. With that, we'll go ahead and get started with Health in the Headlines. Today we open with Health in the Headlines, and each week we will select one headline that has grabbed our attention and we think you, our viewers, would appreciate some clarity on. So we'll go ahead and ask our expert here to weigh in. This week's headline is coming from Axios and reads, "Coronavirus racial disparities are worse than we thought." Dr. Churchwell, I'd love to get your reaction to this.
So that's a headline from Axios, but it's actually not surprising. If we look at just from a cardiovascular standpoint and ask the question as to has there been a disparity in terms of mortality and morbidity from cardiovascular disease between by race, that has been evident and persistent for a number of years. And there are probably multiple factors. When you look at COVID, for example, the data across the country that the Axios report states is that Black Americans are 3.6 times greater, have greater mortality and morbidity than actually and death rates than white Americans. There are a number of issues that actually are interplaying here. Number one, for Black Americans, when they present with COVID, they are presenting with a greater degree of multifactorial issues that actually have a significant effect in terms of their overall mortality. They present with a problem list that usually includes hypertension, diabetes, heart failure, sometimes cardiomyopathy, other significant diseases, renal disease, that actually leads to a significant increase in the overall morbidity that we see with COVID, but also mortality. Also, for Black Americans, they may be presenting later in the disease course, and that again may be an issue around their interaction with their local healthcare system, and the fact in some instances, although they had reported their disease and their issues earlier, they were not actually put into the health system as soon as we would like for them to be evaluated and actually be part of the treatment profile for COVID. It's interesting, at Yale New Haven, Dr. Christina Page actually just had a paper presented in CHESS. We actually did a trial based upon a very old medication that we use for as anti-inflammatory, which showed positive results for patients who actually were COVID. And those positive results were actually greater for Black Americans and Hispanics as opposed to white Americans. And what's interesting about that is that the trial itself was blinded in the sense that all patients it was not defined about whether looking at the patient and then evaluating the patient and then assessing whether they should be on this particular medication. It was really based upon the fact that, number one, you had COVID, number two, you met a particular criteria based upon your laboratory evaluation, and then you actually went into an algorithm, as opposed to that being a clinical decision made by your clinician or by the nursing staff. And interesting to me, that actually showed a very positive response for the patient population, for African Americans in particularly, when actually placed in a great sense in a blinded way for the evaluation of our patients for the appropriate therapy. So, taking those into consideration and thinking about the fact that we need to be more aggressive in what we do in resolving the issues of the comorbidities for patients, especially their cardiovascular comorbidities, and also getting patients earlier into the system, and also being a bit more blinded in terms of being aggressive in terms of therapy, not really dependent upon the gender, nor by race, nor by age, I think is going to be important.
Doctor, thank you so much for that. Now we'll move on to You Asked, We Answer. And in this segment, You Asked, We Answer, we focus on answering your questions. And each week we ask you to go ahead and submit your questions to have them answered live here on the show. Last week, we addressed questions around sticking to your treatment plan in the face of COVID-19. And if you missed it and you would like to watch, you can go ahead and visit House Call's website at heart.org/housecalls to find all of our previous shows. And this week we are focusing our attention on the Coronavirus Aid, Relief, and Economic Security Act, known as the CARES Act. Let's get right to your questions now with Dr. Churchwell. Our first question comes to us from Gloria in Golden, Colorado. And Gloria asks, there's been a lot of news coming out of Congress since the pandemic began. How have lawmakers responded to COVID-19? Doctor?
So there's been a significant response. The short answer is that lawmakers they've actually passed 4 major pieces of legislation. That's roughly $3 trillion in federal spending. In comparison to 2008, when we were at the point of a depression, Congress passed $831 billion in terms of spending. So quite a bit more. It's come in a couple of different tranches in terms of the support. The first came as a Coronavirus Preparedness and Response Supplemental Appropriateness Act. Then the Family's First Coronavirus Response Act came on March the 18th. And then there was the Coronavirus Aid, Relief, and Economic Security Act, or there was the CARES Act, which came on March 28th. And then the Paycheck Protection Act, which has been important in terms of having resources available for those who are actually unemployed or actually were furloughed for up to $1,200 per person, but actually significantly more for families to help to support them in this particular area. What's important to realize is that although $3 trillion is quite a lot of money, Congress is in the midst of actually looking at additional support, because we are finding that it's not going to be enough to really support families and for the supporting architecture like medical systems to get us through from a financial standpoint through this pandemic. You know, the Heart Association supports this, as many public groups, to marry the need from a financial standpoint across multiple lines to ensure that patients have appropriate access to care and also can support themselves through the pandemic from a financial perspective.
Very good. And we're getting a lot of folks interacting with us. David Nateki, hello from Buffalo, New York. David, thank you so much for joining us for our live show. And I'm seeing Miss Pappas. Hello from Dallas. Hi to you in the great state of Texas. One more here from Joan Burrell. Hello from Georgia. Thanks to all of you for joining us. And moving along now to our second question. And this comes to us from Reed in Santa Fe. Hello, Reed. Thank you for your question here. Dr. Reed asks, I've been given mixed information on whether my health insurance will cover medical treatment for COVID-19. Is Congress doing anything to address that?
It's a great question. So the good news is that health plans, including all private insurers, Medicare and Medicaid also, are really required to cover approved diagnostic testing for COVID-19 at no cost to patients. So if you're uninsured, you can receive COVID-19 testing and related services without actually getting a bill. And that your state's Medicare program provides an option for you to sign up for and ensure that shouldn't be an issue. The complication will be, as we know, that the overall treatment for COVID is prolonged. And the goal is that you will not receive a bill for that particular treatment, whether they're actually on the ambulatory side or on the inpatient side. I think we are seeing some patients actually getting some bills from the private insurance, and those are hopefully being resolved. The big issue that going forward, because this pandemic will be with us for months, are those individuals who've been furloughed or unemployed and actually have no insurance. The opportunity to join Medicaid at your local state program, or actually being able to join the ACA, is going to be key to ensure that you actually have insurance coverage going forward if you actually get COVID and actually need medical help. AHA definitely supports the reopening the ACA for enrollment to ensure that those who do not have coverage can get coverage, so that these bills will not stack up and that they can have the right support both clinically and financially to get them through this pandemic.
Very good, Doctor. Thank you. And moving to our next question here from Liz out of one of my favorite cities, Austin, Texas. Liz asks, we've seen a lot of media coverage of low-income children who receive free or reduced price meals at school no longer having access to those essential sources of food during the pandemic. Does the CARES Act address that? Really important question there.
So the CARES Act has worked to address that. Congress has provided emergency funding for child nutrition programs nationwide to ensure students will receive free or reduced price school meals during the pandemic. Congress also created the Pandemic Electronic Benefit Transfer, or the PEBT program, for families of children who receive free or reduced price meals at school. The program does provide families with electronic cards so they can use in grocery stores. Lawmakers are working aggressively to try to as at the state level and also at the nonprofit level, to try to ensure that children and young adults actually have access to food and nutrition during the day and during the evening in this pandemic. But obviously more is going to need to be done. It is very evident that this pandemic will last on the order of not months, if not years. So Congress, in terms of looking towards additional funding, is going to be key, and I think it's going to be part of the legislation that is actually coming up that's going to be assessed and evaluated in July. And AHA definitely supports that.
And we have more questions to get to. First, I want to take a quick polling break here and throw up these poll questions so we can continue to interact with our wonderful audience. If you joined us later in the show and missed our earlier question, you can start by texting AHA Live to 22333. And if you've already registered, you don't have to do it again. You just get ready and text your next answer to 22333. And as always, I offer apologies to the audience for all my paper shuffling, because we do our best to make sure we're getting your questions live time and your answers, of course, to these poll questions on the air. So let's go ahead and throw this one up. Have you taken advantage of telemedicine since the beginning of the pandemic? And you can see here it's a yes or no. Doctor, I'd love for you to weigh in on this and just sort of your thoughts in general about telemedicine. A lot of experts I've been interviewing say that it has really been wonderful to see people communicate through telemedicine and not put their health to the side while they're concerned about going to appointments in person.
It's been remarkable. If we look prior to COVID and the distribution, the utilization of telehealth, it was actually minimal. And it was difficult for patients and also clinicians to work towards the interaction and the interconnectivity to use it effectively. In a very short period of time, we have gone from very minimal use to actually being one of the key elements for the interaction and for long-term follow-up for patients at if not all of our ambulatory centers, and also from the inpatient perspective. So I think at this point, telehealth is here to stay. Importantly, I think Congress and the federal government is looking towards the fact that one of the big issues previously was that it wasn't paid for, and that at this particular point it is being paid for. We're still in the arena of thinking towards how it should be paid for, and effectively what's going to be the long-term utilization of that particular resource, and how financially we can make it more secure. But I think it is here to stay. We will actually continue to evolve how it can be used, and should be used effectively to take care of patients.
And you can see the respondents there, about 57% saying yes, they have taken advantage of telemedicine since the beginning of the pandemic. Let's hold on that for just a moment longer, guys, if you can. Walter's doing a great job producing this show, and all of the AHA team. Doctor, I'd like to just ask you just to add on to this question, because I do quite a bit of reporting on the subject of mental health. And I've talked to several experts in the behavioral and mental health field who have told me that telemedicine has been really wonderful to allow people to take that first step, because of course the pandemic has caused a lot of concerns about not only physical health issues but mental health issues.
Yeah, it's been actually for those with mental health issues here in Yale, New Haven, it's been a remarkable utilization of the particular resource. We actually closed all of our inpatient evaluation centers because of COVID, and we then operationally made it available for all of our patients to have a telehealth pathway for that evaluation. And in actuality, it's not only been helpful for those patients, we've been able to expand it to more patients. What's even more interesting is that our psychiatrists and our personnel tell us that from a patient perspective, they are actually more giving, they're more outward in terms of wanting to discuss their issues with telehealth, as opposed to being being one-on-one in person. It's their thinking is that disconnect has allowed people to be actually more personable, and actually have led them to be more outward in regards to their problems, for their diagnostician and their clinician to be more helpful in terms of their care. So we're aggressively, and I think across the country and many others are thinking about expanding this capability for telehealth in the mental health arena, because we found it to be incredibly advantageous for patients.
Yeah, thank you so much for that. And we'll put up one more poll question here, and then we'll move on to the rest of your questions for the expert. So we were wondering, on average, how many steps do you get in each day? Are you keeping that body moving? You can see there less than 6,000 steps, 6,000 to 8,000, 8,000 to 10,000, or over 10,000 steps, or I do not track my steps. So we'd love to hear from you and your thoughts about whether or not you're keeping track of how much you move during the day. And Doctor, I know that this is really important, and you guys are encouraging people to keep active, and tying that back to your answer right there, your wonderful answer about the mental health. These things are all tied together, are they not?
Oh, definitely. Your mental health capability and betterment in terms of overall health is tied to not only your emotional stress, but your physical stress. So the more that you can move around, the more that you can do during the day in a concerted effort to keep yourself healthy, that actually has a significant impact on your cardiovascular health, the better. The more exercise you do, the lower your blood pressure is going to be, the better control of your diabetes will occur, and the better improvement in terms of all of your cardiovascular symptoms. I have a treadmill in my office, and the problem with the pandemic and Zoom is that I'm actually on the computer too much at this particular point. But the goal still needs to be those 8 to 10,000 steps, and even greater if at all possible, trying to do that at least 5 days a week. Think about your exercise in a way of how can you actually encapsulate and cordon off during the day those 20 minutes that you're actually doing something that's actually outside of sitting down, that's going to actually keep you mobile and move towards better cardiovascular health.
I had the same concern because as a journalist, I'm on the computer all the time. So I took a cue from my 10-year-old daughter. She always wears a Fitbit, so I got myself a Fitbit, and then
Great
we
idea.
compare notes at the end of the day to see if mommy or daughter is moving more during the day. So that's been very helpful for me.
My wife and I have a competition at the end of the day. We both have Apple Watches, and we look to see how many steps. She's a little shorter than I am, so she always wins.
I love that. And thank you so much to everyone for checking in with us. You can see there what the respondents are saying. In general, it looks like y'all are really keeping moving, and we love to see that. So thank you so much to everyone for interacting with us. And I see some more folks checking in right now. Ellen Childress King from Atlanta, Georgia. Hi, Ellen. Thank you for being on our live show today. And Kay Hughes from Barbados. Kay, thank you so much for checking in with us. Now we'll move on to our next question in our You Asked, We Answer segment. Sarah from Puerto Rico asks, Congress has made a lot of changes in the area of telehealth. What does that mean for patients? And I know you touched on this a bit, but let's expand if we could for Sarah in Puerto Rico.
So accessibility should be actually a key issue that we need to continue and actually to expand. One of the keys is that we want to ensure that how it's paid for doesn't have an impact from a financial standpoint for patients, that it actually should be assessed and evaluated and paid for like the pathways for one-on-one communication from an insurance standpoint. We should be able to continue to expand and evolve telehealth, that we will be able to do biometric evaluation, so understanding and evaluating your blood pressure and heart rate, and even your ECG should be done actually at that particular sitting. And also the convenience factor, I think, is incredibly important. Being able to align your schedule with your clinician, your provider schedule in a way that's unique, so that you're not sitting in the waiting room for 20 or 30 minutes waiting for the physician or waiting for your provider, but that this can be scheduled, and the fact that actually is convenient for you and convenient for your provider, I think is going to be incredibly important as we continue to understand the impact of telehealth and how to expand it.
And I should read this shout out for you, Doctor, from none other than the CEO of American Heart, and saying that you are such an inspiration to all. So I just wanted to let you know that's the pretty good kudos coming in there. Now I'll ask a question from, and I hope I'm saying his name right, Philippe from California. And he asks, what has Congress done to help the nonprofit community during the pandemic?
So this is actually a difficulty. When you look at the CARES Act and also looked at the Paycheck Protection Program, those were really for those particular organizations that had with only 500 employees or less. A not-for-profit and an organization like AHA has quite a few more employees, and really did not take into consideration philanthropic organizations of our size or even smaller, which actually is having a significant and negative impact in terms of the overall finances for AHA and for many institutions. These institutions are really the lifeblood of thinking about how do we go out to communities and work on pathways of care, and to be the advocates for patients and for physicians and providers and researchers, to ensure that we are actually having the opportunity to expand our capability to treat patients, to look for exciting and new areas of groundbreaking research, and moving forward in this. So, one would hope, and we definitely support with the next tranche of money that actually is going to come from Congress, that organizations like AHA are taking consideration so that we can continue to support our mission in the appropriate way.
Thank you, Doctor. And hi to Elaine Aboud, who is watching from Brazil. Thank you very much. And one more from the great state of Texas, Lisa Krasinich. I hope I said your last name correctly. Lisa, thank you very much for checking in with us. Doctor, obviously our viewers and our audience had a lot of questions around the CARES Act. So thank you so much for providing clarity on all of these answers. All of this being said, I wonder if we could, as we wrap things up, your time is very limited. If you could just talk about what this means for our audience, what in general, as a whole, what can we do as citizens to help? What are the next steps?
Yeah, it's a great question. AHA at its core is an advocacy group, works at the grassroots, and we need volunteers like all of our folks who are actually looking in on this morning and this afternoon across the country, who can urge lawmakers and policymakers to support policies that improve people's lives. We have You're the Cure grassroots network, where we have passionate advocates from every state and every congressional district who want to end cardiovascular disease in America and around the world. So please take the opportunity to visit you'rethecure.org to learn more. And while you're there, visit our Action Center to contact members of Congress about important issues, including surprise medical bills, which can throw patients and families into financial turmoil. I just wrote an editorial with one of our executive advocacy personnel to talking about the issue of surprise medical bills and its huge impact on the financial situations for many patients, and that we have to come to a resolution of how to take this under consideration so that families and the individual patients are not so negatively impacted, so that they actually, although get their care, find themselves in incredible financial hardship at the end of that. That needs to be resolved, and you can play a role in that. You can actually call your congressman, become part of You're the Cure, and lend your voice to this and many other matters which are important for us in terms of improving cardiovascular health.
And Dr. Churchwell, and one final thing before we let you go, you are such an advocate for the community and for people's health and well-being. A lot of folks are still afraid. As you said, we're not close to being finished with the pandemic. Can you leave the audience with a few words of inspiration? People are still living in a lot of sense in fear.
That's a great question. We continue to be at an important time in this country of how we are responding to the pandemic and what we can do to keep ourselves safe. There are things that you can do, things that have a huge impact in terms of your ability to keep yourself safe, your family safe, and your community safe. And they're simple. Number one, wear a face mask. Number two, wash your hands. Number three, social distance. Those are actually key issues, whether you're at home, whether you're at work, as we actually continue to work towards opening the country, that are going to be incredibly important for us to actually get through our first wave and also hopefully not to have a second wave with this particular pandemic. Realizing that it is not over yet. These are those three simple and very direct things that you can do that will have a huge impact on what happens to the rest of us and to yourself in regards to COVID-19.
Dr. Churchwell, thank you so much, sir. It was such a pleasure speaking with you today.
Thank you for the opportunity. It's great meeting you.
You as well. And to our audience, if you've enjoyed today's show, you can find more great conversations on the American Heart Association's brand new podcast. I love this podcast, Stories of the Relentless. And you can find it on heart.org, iTunes, Spotify, Google. So please go ahead, go check it out and subscribe and share your thoughts in the reviews, and be sure to share it with your friends and family. And to wrap up today's show, we want to bring it back to you, our audience, and with some final thoughts from you during our segment. What would you say? And I'm continuing to monitor all of you good folks checking in with us. Paula Berens from Longview, Texas. Hi, Paula. Thank you so much for being with us. And if you've been with us throughout the show today, you already know what to do. You can grab your phone and you can get ready to text your answer 22333. And first step, we want to know what device you are using to watch the show from. This is really helpful in finding out information about how we can best serve you, how the American Heart Association can best serve you. So if you can tell us if you're viewing from a phone, a laptop, or a tablet, all of the above, other, that's one of the questions we would love to hear from you. And I'm seeing so many of you checking in with us, and even some other friends in nonprofit community. Clarissa Garcia, it's so easy to join. And thank you so much, Clarissa, for checking in with us. We really appreciate all of you. It's been a pleasure to be able to bring your questions directly to these experts. We have the best experts in the country, as you just heard from Dr. Churchwell, so well respected, and they're graciously carving out their time to answer your questions, because getting straight answers to important health questions is absolutely critical. Our final question of the day addresses what you want to hear about on the show, because what you tell us drives the editorial and how we plan the very next show. It's all about you, the audience. So what topics are important to you, and what are you interested in hearing us discuss? You can tell us which of the topics that you'd like to hear more about. I have a few selections here. The caregiver chat, you're holding it all together. Let us support you too. Would you like to hear about that? Or preparing for your telehealth visit. We talked quite a bit about telehealth, and there are some promising things going on. So tell us, do you want to hear more about the caregiver chat? You're holding it all together. So many people who are caregivers, they just give everything to their loved ones, the friends and family for whom they take care of. And we would love to know if you would prefer to hear about the caregiver chat or preparing for your telehealth visit. And we are monitoring all of your responses as they come into us live time. We can see a lot of folks right now clicking on the caregiver chat. I'll just hang with that for a second to see if we get any more responses coming in. And once again, I'm loving to read all of your notes here. Monica Downer just wrote to us here and said that she'd like to hear a lot more about the caregiver chat. Monica, thank you very much. Duly noted. We've got your response here, and we're going to go ahead and take a look at what the audience says as a whole, and we will bring that episode to you next week. So keep those responses coming. We are monitoring and reading every single response, and we really appreciate all of you checking in with us for our third episode of this show. Thank you so much for joining us. And as I mentioned earlier in the show, you can find all of the previous shows at heart.org/housecalls, and be sure to join us next week. Whichever one of those topics comes up the highest on the poll is probably what we will be talking about next week. You can find us here, same time, same place. And thank you all so much. For now, I'm Carrie Pena. Stay safe and stay healthy. Take care. Learn more about House Calls, Real Docs, Real Talk, and submit your questions at heart.org/housecall.